Typically, a low-dye strap is used for patients that have heel pain or plantar fasciitis. We can flex the great toe, and it's easy to see the margin of the plantar fascia. As we follow it back into the heel, most trouble is right in the area at the insertion of the fascia. So our next step is to go ahead and put a low-dye strap on. We're going to do a low-dye strap on the foot. We're going to first use some tough skin adherent. It helps the tape to stick, and it also helps condition the skin a little bit so that we don't get a blister. We usually start with 3 strips of tape on the bottom. We don't want to go past the metatarsal head on the great toe or on the 5th toe. So we'll start by placing lateral on the foot. We're going to move it around to the great toe joint area, and I'm going to plantar flex the first metatarsal slightly and then adhere our tape. We usually put 2 strips of tape on for support, and again plantar flexing slightly that first metatarsal. Our next step is the bottom, typically 3 strips. Being very careful not to extend it past the margins of the tape. And then our last strip around the foot is basically to dress down any of the ragged, torn edges of the tape so they don't snag on socks or shoes. And it kind of covers up most of the edges. We'll use what's called a rest strap, and that typically is a double-backed piece of tape so it doesn't stick to the top skin. When I apply the rest strap, we'll start with loading the foot with a little pressure because it will widen up slightly while there's weight bearing on it, and so the tape consistency should be loose on the top, but when we put pressure it should snug up.